Dr. Morrow?
Sounds good. And just to let you know, I'm going to cover a couple of extra topics today. So I'll go through everything and then we'll open it up for questions. So with respect to our COVID-19 activity, unfortunately, we continue to have high but relatively stable levels of COVID-19 activity. So no new news there. Last week, we had a total of 702 new reported cases. So that's a little bit down from the week before, but not substantially. Our hospitalizations are stable. And unfortunately, we continue to have deaths that are attributable to COVID-19 in our community. Similarly, our monkeypox situation and our hepatitis A situation are relatively stable. We do have 2 new cases of hepatitis to report this week. And our monkeypox, as you all know, the state now has a daily update of monkeypox cases. So you can look to that, but there are no significant changes in our districts. There are 2 things that I wanted to highlight, though. One of the things that we have noticed in the last month or so is our vector-borne illnesses. And so we really want to make sure that everyone is aware that while we may think, oh, Labor Day is here, summer is over, tick-borne illnesses are frequently peak in the fall, even through October. So it's really important for people to make sure that they are taking precautions to protect themselves against insect-borne diseases. And so here in the last couple of months, we've had cases of a viral disease called Erlichiosis, that is a tick-borne disease associated with Lone Star ticks, and of course, Lyme disease, which we know is endemic in our area. In addition, we had a case of West Nile virus reported to us last week. West Nile virus is a mosquito-borne illness. And so we just want to raise awareness that this time of year, it's quite common for us to see insect-borne illness, specifically Lyme disease, Erlichiosis, and unfortunately in this situation, we also have a case of West Nile virus. So we encourage people to take precautions against tick-borne illnesses or mosquito-borne illnesses. So for both of those, wearing long sleeves, wearing long pants, using insecticides, so insect repellents, are all ways that we can decrease the risk of insect-borne illness or vector-borne illnesses. In addition, we would strongly encourage people with respect to tick-borne illnesses to make sure that they keep the areas around their houses, mowed lawns, and really try to pay attention to overgrown areas, which is where ticks like to inhabit. Similarly, with mosquito-borne illnesses, we ask that people look for standing water and do their best to minimize standing water. So that's an update on insect-borne diseases. In addition, one of the things that we're very concerned about in our districts is the ongoing increase in STIs. We know we talked about that earlier this year, but unfortunately, the last couple of months have really shown that our STIs have increased most significantly with syphilis. And when we look at our July numbers, when we review our monthly reports of data, right now, we've had over 60 cases of syphilis reported to us. That compares to, on average, 30 cases, and that's only through July 30th. And so we really need to continue to encourage people to do everything that they can to prevent the transmission of sexually transmitted infections. We also want to make note that traditionally, or most recently, we've thought of syphilis predominantly impacting the population of men who have sex with men, the MSM population. But now about a quarter of our cases of syphilis are being identified in women. And with women in particular, we worry about women of childbearing age who may become pregnant. We really need to do everything in our power to prevent what we call congenital syphilis. And so we really want to make sure that everyone is aware that syphilis is significantly increasing. We need people to use precautions, to do those common sense precautions in reducing STIs. And what we're doing here at the Roanoke City Alleghany Health Districts is we're increasing access to both testing and treatment. And we're working with our community partners to increase awareness and education about STIs. So I know that's a lot of information, and I'm happy to take any questions that you may have.
Dr. Morrow, this is Tom Britt, WFXR. In the last few minutes, we're hearing that there might be monkeypox may have contributed to the death of a person in Harris County, Texas. Has there been any characteristics or any categorization of how severe the cases are here in our district or our area?
Yeah, so I think, I haven't heard of that. I will be totally transparent. I have not heard of that yet. I think it's really important for us to remember that, we're talking about 18,000 individuals identified with monkeypox across the country. It is overwhelmingly a mild illness. And certainly what I can say is that the cases that we've had in the Roanoke City Alleghany health districts have all been mild. There is the occasion where someone might be hospitalized mainly for pain control, if they have lesions in areas that can induce significant pain. But that really has not been a significant issue in our districts. So overwhelmingly, monkeypox is a mild illness, primarily a rash, some viral symptoms, fever, myalgias perhaps. But of course, in any situation with any disease, there may be an exception. And so I'm not familiar with this case at all in Texas, but it doesn't change the reality that this is an overwhelmingly mild disease. That said, even if it's mild, it's causing significant discomfort for those who have it, and it's transmissible. So we want to continue to do everything we can to empower people to prevent the transmission of it. And one of those things is to get vaccinated. So across the state, there are monkeypox vaccination interest forms. We have them on our website. And what we certainly do is encourage anyone who's in a high-risk group to get vaccinated against monkeypox. And of course, we really encourage everybody to engage. If we think about the STIs that we talk about, really engage in safe sex practices. We know that anonymous sex with multiple partners, unprotected sex are all increased risk factors for STIs. And while monkeypox is not an STI, that close skin to skin contact increases the risk of transmission of monkeypox. Sorry, I'm looking at the chats. So Jean had a question about International Overdose Awareness Day. Thank you, Jean, for bringing that up. How does VDH track these numbers, and is there a concern that they may be very high in parts of our local districts? So like every place in the country, we are very concerned about overdoses. Virginia Department of Health at the central office level tracks both fatal overdose data, and they provide that to us on a quarterly basis, as well as emergency department surveillance. And so we at the local level really rely on those data to see what's happening within our communities. But I think it's also important that we rely on our partnerships with our EMS partners, with our first responders to help us understand what's happening in our own districts. We in Roanoke City specifically are disproportionately impacted by substance use disorder. And if we look nationally at where we rank based on some recent information, we rank third in the state of Virginia for the highest fatal overdose rates. And Virginia ranks relatively high. So nationally, we're in the top 50, I think it's 50, I'd have to check that, but certainly within the top 100 localities with respect to fatal overdose deaths. And this is, again, this is data that was provided to us through CDC and an organization called NACCHO, the National Association of County and City Health Officials. So a lot of information. Bottom line, Jean, thank you for bringing it up. We continue to struggle with opioids, substance use disorder, and I'm really thankful that we have really strong partnerships in place. We've got amazing partners with the drop-in centers, with Virginia Harm Reduction, and of course with our healthcare delivery systems. Our first responders are on the front line dealing with overdoses. And so we're continuing to partner with them to minimize the impact of this deadly epidemic of substance use disorder. I'm just going to look at a couple of questions in the chat, and then I'll open it up to questions from you guys. The future of COVID testing, what do we expect with respect to access to testing and vaccines? Well, we know that the federal program is ending, and we certainly encourage everybody to take advantage of that as quickly as they can. But I think it's also important to realize that there is still a lot of access to testing. We're going to continue to work with schools to make sure that they have access to testing. A lot of insurers are covering the cost of testing, so people should check to see if their insurance covers COVID-19 testing. And then we feel that in our job, as always, we're focused on equity. So Virginia Department of Health, specifically the Roanoke City Alleghany Health Districts, are focusing our testing distribution for our most vulnerable populations. So working with community-based organizations who serve individuals who may not have insurance. And I should also include that some libraries still have testing availability. So we know that there's plenty of testing available, and we know that a lot of insurance companies cover testing. If someone has a question, they can certainly reach out to their local health department. Oh, and I see that Christy put the ED surveillance data up there. Thank you, Christy. And as another question in the chat, am I concerned about the cases of monkeypox going on with college kids back in campus? How worried should K through 12 parents be? So most of our monkeypox cases are happening in the older, younger population, if that makes sense. So, 25 to 35, and then the demographics are up on the VDH website. There is a range, of course. I would say that monkeypox is a very preventable disease, and I don't expect, certainly there's no reason for monkeypox to be transmitted in the K through 12 setting. It really requires close skin-to-skin contact, intimate contact. And so it's not something that if I were the parent of a K through 12 age child, I would be concerned about. If my child is engaging in sexual activity and high-risk sexual activity, I would be concerned for them for monkeypox as well as for all of the other diseases that we just talked about. So certainly not related just to monkeypox. Same thing with the college age population. If someone is not engaging in high-risk behavior, the risk of monkeypox is exceptionally low. So this is a direct message. Can I contextualize the raise in STIs? What kind of increases is VDH tracking? Is it statewide? And how the numbers compare to pre-pandemic? That is a great question. If we look at our numbers pre-pandemic, specifically looking at syphilis, we had on average 30 cases a year for the last few years prior to the pandemic. Syphilis really has a very variable history. During the pandemic, those case counts dropped significantly. So we saw 10 cases in 2020 and 10 cases in 2021. To contextualize it, we're at 61 cases in year to date 2022, just through July 31st. Now, syphilis reporting is challenging because there are different stages of syphilis, and not all stages are reportable to the Centers for Disease Control. It's a complicated issue, and I'd be happy to do a one-on-one with any of you if you want to get into the details. But the way we've been tracking it, pre-pandemic, about 30 cases per year. During the pandemic, about 10 cases per year for those 2 years. And now in 2022, we're at 61 cases. We do think that some of this is delayed or avoided access to care during the pandemic. We can't really put a number on that. But the key message here is, like monkeypox, syphilis, the transmission of syphilis is entirely preventable. we have medications for it. We know how to treat it. We know how to diagnose it. And we know that when people engage in safe sexual practices, it dramatically decreases the risk of syphilis. So we really need to get the message out there that STIs are on the rise and people need to protect themselves. Okay, I think I've covered everything in the chat. Christy, if you could please check it. Are there any other questions for anyone want to bring up a question on live chat?
Dr. Morrow, you mentioned there were some new cases of hepatitis. Is there any connection to the rest of our community in any way?
No, not that we know of. And in case, you know, in the last two cases, actually are looking like they might be sporadic cases. So we've talked about this over the last few months, that in any given year, we have 3 to 5 cases of hepatitis that might be related to travel, or we never know. That the last 2 cases do not appear to be related to the outbreak that we were having predominantly in the population of individuals who uses injection drugs. So of course, we're doing careful investigations to see if there's any connection that we can find, but there is not, to our knowledge, at this point. And that's true, you know, every time we get a case, we do a thorough investigation to look for commonalities. So there's another question in the chat. Do I have any tips for kids going back to school to prevent COVID? And now that masks are not required. And certainly the first and foremost, thank you, Alyssa, for bringing this up. First and foremost, the strongest recommendation that we have is to stay up to date on vaccines. And we're looking to the FDA, the CDC, and the Advisory Committee on Immunization Practices in the next week or 2 weeks to make a recommendation for the bivalent COVID vaccine. So when that becomes available, when it's approved, when it becomes available, we would certainly encourage those people who are eligible for the bivalent COVID vaccine to get that. And we'll certainly be offering it once it is approved and available. But in the meantime, in addition to making sure that your children are up to date on vaccines, if that is what you'd like to do, I would certainly strongly encourage it. Parents can still choose to have their children wear masks, and that's really up to parents to make that decision with their children. I would recommend that because most of our communities are in high transmission, indoor setting, close contacts, I would certainly encourage my children to wear masks if they were in that setting. So I think that that's really up to the parents to have that discussion with their children. From a public health perspective, we strongly recommend vaccines, and we strongly encourage the wearing of masks when a community is high transmission. In addition, please, please, please stay at home if you're sick. We don't want anyone transmitting this to anyone else if we can help it. And then always, as we go into flu season and upper respiratory infection season, make sure that you cover your cough and practice proper hand hygiene. So those are our traditional messages. So there's a message in the chat. If I could please reiterate where we are with COVID. Right now, we continue to be at high but stable levels of COVID-19 activity. So if we look at our weekly activity, it's down a little bit from last week, but it is not significantly down, much to my disappointment. Our hospitalizations are stable. We have 33 people hospitalized in the last week. 27 of those are new hospitalizations. And unfortunately, we continue to have deaths attributed to COVID-19. So since last week, we had an additional 5 deaths attributable to COVID-19. So, you know, we still are in a very high level of COVID-19 activity in our community, and we continue to encourage people to assess their risk tolerance and take those steps that we just talked about to protect themselves and their loved ones. Are there any other questions? Oh, so another question about resources for long COVID. Unfortunately, I really don't have a great source for resources for long COVID. Long COVID is a really puzzling still really unknown disease. We don't know for any individual what their resources might, what they may need. So I would strongly encourage anyone who has long COVID to talk to their provider and see what their healthcare professional has to offer. We don't have anything specific here at the Roanoke City Alleghany Health Districts for individuals who are suffering with long COVID. I do want to make sure everyone knows that the more protected you are. So if you're up to date on your vaccines, the more protected you are against COVID-19, the more protected you are against long COVID. So I certainly know several people who aren't necessarily concerned as the virulence of the current B5 COVID strain it is less dangerous. It's important for us to be transparent that it is less dangerous. They're still so worried about long COVID that they're taking those same precautions. So it gets back to risk tolerance, and people who want to avoid long COVID really should make sure that they're up to date on vaccines and wear masks right now, given that we're in high transmission. All right, I'm not seeing any other questions in the chat. Any other questions from the field?
All right, well, thank you all very much for joining us, and you can look for the data to come back out by email shortly. So thank you again.